First of all, I'm Michael Dent. I'm a dentist here in Ashburn. We've been involved here in Turner County for several years now with a rural health group that looked for ways of addressing a lot of places here in rural South Georgia. There's a lot of people that just sort of fall through the cracks, that have health needs that just aren't being addressed either through lack of providers. The financial aspects of that is a big problem for a lot of people in rural parts of the state. So we were looking for ways to just improve people's lives as far as access to care, education, and those types of issues. And our first initial thrust was working primarily with patients who were hypertensive or diabetic. And we received a grant several years ago that allowed us to set up a volunteer network here for having people to be picked up and taken to their doctor's appointments. That was a big issue for us here, transportation, so we've got that put in place. Helping people, assisting people in getting medicines, even finding a lot of these free programs for getting free medicine that people just weren't aware of, and assisting them in the application process of doing that, improving people's lives that way by getting them medicine like that. But the thing that we kept seeing over and over again, we were addressing a couple of needs, but we just saw so many people whose dental health was just atrocious, and just, again, very few dentists in this area, just not enough access to care, that sort of thing. So we saw that we were making headway in some issues, but the dental thing was something that just kept coming up. It's hard for us to get diabetics to eat well if they don't have good teeth, and that became a real problem for us. So we wanted to try to address that issue as well. We also do have a dental hygienist who's on staff full-time. She's actually there Monday through Friday. And so Monday through Thursday, she spends her time going out into the communities and doing dental health education. And for me personally, I think that's going to be probably the longest standing effect of this grant. Really even more so than those of us actually going there and doing dental work on Fridays. I think the effect of her going in and visiting schools, visiting nursing homes, these types of things where she's going in and giving education is really going to be the most long-lasting effect of this, and we're really excited about that. That she's able to do that. She makes a lot of contacts. Here in the summertime, she said, even as school winds up, actually her schedule's going to get even more busy because she's got so many other places that she can visit there as well.